Okay, if you've experienced it or know someone who has, you know that pain from shingles can be excruciating, but it doesn't have to be. There's a vaccine for it, and here to tell us about this breakthrough, we have PharmD President and CEO Byron Yoshino and Clinical Pharmacy Manager Reese Uyeno. Nice to have both of you on Living 808.
No, thank you.
Thank you.
Now, we love keeping everyone on top of all the health breakthroughs, and this is a big one. Can you tell me about this?
Yes, well, shingles is a very painful experience if you've ever had that. So personally, I've had it myself on my forehead and on my scalp. And for 2 weeks, it was very, very painful. So highly recommend thinking about the vaccine.
Reese, tell me more about the vaccine and how many you've been able to administer, and is the word getting out about this?
Oh, yeah, definitely. So across all of our Pharmacare retail pharmacies, a good amount of patients have been coming in on a monthly basis and getting the Shingrix vaccine from us. And we actually have a couple clinics every month at various locations at Pharmacare for patients to come on down and get their vaccination.
Now, who should be receiving this? Who's the ideal candidate?
So the ideal candidate for the Shingrix vaccine would be all patients above the age of 50, and there's two main reasons why. The first reason is anyone who's had chickenpox in the past is at risk of developing shingles later on in their life. And the second reason is because as patients get older, there's an increased risk of their immunity going down, which puts them at a higher risk for getting the shingles.
Now, how effective has the vaccine been proven to be?
Well, with this new Shingrix vaccine, it's proven to be effective 90 to 95% in preventing shingles from occurring. Wow. So if you get the 2-shot series, your likelihood of getting shingles is close to 0.
Now, I know we have people's attention at home, so how many doses of Shingrix do you receive? What is the process like?
So every week we get a certain allotment at our pharmacies, and patients can call our pharmacies and schedule themselves to come in to get the vaccination, and we recommend them to call in and have their prescription sent over by their physician. That way it's a seamless process once they check in the pharmacy and receive their vaccine. And then secondly, after they receive the first dose, we typically schedule the patient to come in about 2 months later for their second dose, because it's a 2-shot series.
Terrific. And Byron, I'm sure that this is exciting for you to be able to bring to everyone, having yourself gone through this shingles.
Absolutely. So while there are side effects, and it can be painful in some cases, it's very much milder compared to having the shingles. So highly recommend, if you're over 50, to come see us and get your shots.
Well, John is actually standing by with Paul, who, would we be able to demonstrate this live, how this works? Would you be able to do it for us, Reese?
Yes,
All right.
of course.
Come on over.
Okay.
We have our victim. I know he doesn't look 50, but we checked his ID, and he is, in fact, over 50 years old. Really?
Okay.
Like, I can't believe it. This is Paul, by the way.
Hi, Paul. Okay, just give me one moment.
35 years.
Put on the gloves.
High school.
Make it really sore.
Oh, stop.
No, I'm kidding. How easy is this?
It's going to feel just like the flu shot going in.
Okay, so not sore at all, then.
No.
Shots.
You're going to feel a little pinch and a little pressure.
Okay.
But, again, just like the flu shot, it shouldn't be too bad. If anything, the next day, you may feel a little pain, little dull pain, kind of like a little bruise.
We are doing this live right here on the Living 808 set. Oh, boy. Okay. We're getting a close-up. I should actually bring my phone here.
So I'm going to put half the Band-Aid on to make it easier for me.
There we go. Okay, so it's already on there. Okay, we're not going to take a close-up just for fear of people that have a fear of needles.
Correct.
So,
okay.
but we will tell you that this is actually happening.
Okay, on a count of 3, Paul. 1, 2.
Oh, you should have done it on 2. That didn't hurt, did it?
Actually, I didn't even feel it.
Okay.
Oh, good.
So go ahead and rub it and move your arm around, and that will prevent it from getting too sore the next day.
Super easy, painless, and very necessary, because I know that we talked about him having shingles.
Oh, definitely.
It's not a fun thing.
No, it's not.
Pharmacare Hawaii, thank you guys so much for being here. I appreciate it. And thank you for what would you call it? Inoculating?
Vaccinating, administration.
There you go. And if anybody needs any information about shingles or wants to learn more, Pharmacare Hawaii will have all the information on our website. Appreciate it. Thank you guys so much. All right, it's National Pina Colada Day. You might want to hang around for that. We celebrate it right here on Living 808. Here on the show, Jason Collins is going to be in studio to make us a special Living 808 Pina Colada. That's coming up. And speaking of celebrations, find out how Revolution is marking a milestone. That and more when we come back.